people who have been able to go through this motion before and who've gone through the journey. And so we're grateful. Eric, Isaac, if you guys have anything to say, please chip in. But I'm just grateful to be able to have this time with you.
Well, I'm thrilled to be here. Thank you so much for inviting me. I can start with a brief introduction of myself. I didn't prepare a formal talk because I wanted to give everyone an opportunity to have like an open dialogue, open forum, any questions that I can help answer for you. And if not, I'll definitely get the answers and get them back to you through either George or Isaac. So does that sound good? Should I just start with an intro?
Absolutely.
Okay. Well, so I'm Jennifer Lee. My nickname is Ara. So George, you might hear that resonating around the hallways every now and then.
Yeah.
I am an attending at Weill Cornell in New York City. So I work as a hospitalist, which is hospital medicine, which is a field in internal medicine, general internal medicine, actually. And I've been at Cornell since 2009. And I'll tell you a little bit about my training background in a bit. But at Cornell, I wear very many hats. So I do some clinical work every year. In addition to that, I'm the vice chair for quality and patient safety for the Department of Medicine. And as of last year, I've also joined the Central MedEd team and work as the assistant dean for program development and operations. And I can explain a little bit about what that is in a little while. And most recently, I am also the president-elect for CAMA National for 2023. So if we can have a little bit more talk about that as well, because I want to find out more ways that I can have the students actively involved in National CAMA and also, provide any recommendations or suggestions on how you can join CAMA once you graduate your residency and fellowships. So that's a brief introduction of what I do. I will say that I'll share a little bit about my background. I'm an atypical medical trajectory, especially for my generation. So I graduated from Barnard College, which is part of Columbia University in New York City. And I was a philosophy and East Asian studies major. So I entered undergrad with the resolution that I would never take another science class ever again. I got a D, actually a C- in AP Bio after getting early decision into Barnard. So that was sort of a very painful moment for me. So I promised I would never do it. I actually took geology as my science requirement in undergrad, which they call affectionately rocks for jocks. But I will tell you that it was probably the hardest class that I've ever taken. I probably just should have taken physics or bio. So with the East Asian Studies and philosophy major, I was thinking about going into law school. Sat for my LSATs, I think it was like my junior year of undergrad, and graduated without applying to any law schools because I wanted to take a year and do my applications. And in that time, I was a paralegal for a private law practice, discovered that I never wanted to go into law, that it was just not for me, and kind of didn't know what I wanted to do. So I was also working part-time starting from my senior year in interior design and public relations. And so I kept that while I was doing my part-time paralegal position, then went into that full-time, became one of the liaisons for one of the major interior design magazines, and had a lot of fun, had a bank account and expense account, did a lot of fun things, took a lot of fun trips, but realized that that wasn't what I wanted to do either. And decided that when I did a real deep soul search, decided that medicine actually is what I wanted to do. I come from a medicine family and watched my father struggle as a 1.5, as a 0.5, I should say, generation physician in New York City, and decided that that was too hard of a life for me. And so that was one of the reasons why I shied away from it, but ultimately really did want to do something meaningful get the knowledge that I needed to help other people, but also to help myself and my family. And that was one of the reasons why I really liked medicine, because it was going to give me the knowledge and the skills that I needed to take care of my family and myself. And I wanted to be able to do that in an informed way. So I did post-bac while I was still working. Took some night courses to fulfill all my prerequisites, and then applied only for medical schools. I only applied to the state university schools because I took out loans and was going to pay it on my own because my parents paid for my very expensive undergrad, and miraculously got in, and decided that I was going to go to SUNY Buffalo. So I went up there for 4 years. And it was a wonderful experience for me. I really did love medical school. I think the thing I loved most about medical school was not only the studying, the knowledge that I learned, but the people that I worked with, and the people that I really got to know. The camaraderie was really nice, being in kind of living, in a small town with a lot of friendly people. And when I was thinking about residency, I wasn't sure if I wanted to do medicine or pediatrics, and decided that I was going to do both. So I took a med peds residency at Mount Sinai in New York City. So I came back to New York, did a 4-year residency there in medicine and pediatrics. And during my 4th year of med peds, decided that I needed to get a job in the hospital. I don't know if anybody knows about med peds, but back then it was a very community-based profession, training you to sort of work in practice. And but the nice thing about medicine and pediatrics combined is that you do a lot of ICU months, and I loved inpatient medicine. I loved the tempo and the speed of and the acuity of illness that you see in the hospital, and decided that that's what I wanted to do. So I took back then you were allowed to do some out of the match within your own institution, and so I got a spot as a pulmonary critical care fellow outside the match at Sinai. And the plan was for me to stay there for the next 3 years and complete my fellowship. But late one night when I was a senior resident on call on a weekend, I saw the haggard pulmonary critical care fellow coming in to put in a chest tube on a patient, and decided that I couldn't do that anymore. I needed to have a life. I needed to have I wanted to have a social life. And so I decided to go into practice, and chose hospital medicine because it was a way for me to stay within the hospital, not go outside into practice, still experience the similar acuity patients, and also work within a very controlled environment, which I enjoyed, and got my first attending job after I graduated at Columbia University Medical School, medical campus in Fort Washington. I was there for 5 years as a junior attending and left there. I loved it at Columbia. I don't know if any of you are at Columbia, but Columbia is a very unique environment in that it's in the middle of a very Dominican heavy patient population, a lot of underserved, very little English spoken. I speak no Spanish, so that was very challenging, but better as an attending than as a resident. But really fast tempoed and a great learning environment for a junior attending. But as you will all soon discover, when you're a junior attending, the only thing I really wanted when I graduated residency was to learn how to take care of patients on my own and make those critical decisions about when am I going to send this patient home, and make sure, how do I know this patient's not going to die as soon as they leave the hospital? And so those are the skills that I learned at Columbia. I also had a wonderful group of colleagues. We worked very closely together. I'm still friends with them to this day. And But when I got into my around my third year of attending, I decided that I wanted to do something more. I've always been, I've trained and worked in academic settings, and I wanted to explore the academic part of it, do maybe some research. I had done no research during my, in fact, I was actually kicked out of a lab because I couldn't pipette. So that was, I knew basic science wasn't for me. Uh, but I had never done clinical research, and I was really interested at that time in medical errors and in patient safety. And so I wanted to explore that more. I was already the sub-I director, but there wasn't any other opportunity for me to grow in terms of exploring other options for career trajectories. And so I found an opportunity to come to Cornell in 09, applied and joined in June of 09 over at Cornell in a brand new academic division of hospital medicine, and have loved it ever since. And one of the things that you'll hear over and over again, I think, from people who are in medicine is the main reason why I am still at Cornell and why I love it so much is the mentorship. For the first time, right, I had gone through medical school, I'd gone through undergrad, gone through medical school, gone through residency, and never really knew what mentorship was until I came to Cornell as a fifth year attending. I've had a lot of role models and I've had a lot of senior friends, but I've never had a mentor. And that has changed, that really changed my life. It actually changed my whole career. I wouldn't be where I am today had it not been for my division chief, who was also my mentor, and really gave me the support, number one, but also the nudges and the pushes that I needed to go a little bit more outside my comfort zone. You know, there's nothing wrong with being comfortable and being comfortable with being good at what you're doing. But what you'll hear from people who have gone outside of that 100% clinician role is that they've gone a little outside their comfort zone. And so that's what I did. I took a project and I made it into a clinical research project, and then got that published. And once you do that, I was able to do it another time, eventually get promoted to associate professor, and then bring my niche and my expertise in quality and patient safety into a vice chair role for the department. And that same skill set that I developed as, the sort of the institution expert in quality and process improvement is what helped me to join the Central Med Ed team in the program development and operations role that I currently hold. It also helped me to start an institute or an academy within Cornell called the Quality Improvement Academy. George might know that there is an elective for medical students called the Quality Improvement for Scholarship elective, and that links directly into the Quality Improvement Academy and the projects that we have for our faculty members, where they join us for a year for some advanced training. And that opportunity actually helped me to reach out to make some collaborations with colleagues in Australia, colleagues in Colorado, colleagues in South Korea. And that has led to trips. And I just actually came back 3 or 4 weeks ago for teaching their residents about quality improvement and how to build that methodology into the training and requirements that they have in research down under. So that's kind of in a nutshell of my path to where I am today. And I know exactly how all of you feel, because even though I say I loved medical school and I really did learn a lot from my residency, there are definitely dark times where it just doesn't seem like you're ever going to see the other end of that tunnel. But I'm here today to tell you that it is better. It does get better. And it's a matter of really figuring out what you want to do, and it's never too late to change your path. And it takes some courage to do that, but it's never too late to do that. Okay. So that's just a little bit about me. I would love to hear from all of you about what you're going through, what you're doing. You know, we can maybe take this opportunity to talk about some of the programs that COMSA ComRAF are running. Any questions that you have for me about my training, I welcome all of that. But I would love if you would, if you do speak, if you could also tell me where you're from and what year of training you're in.
Thank you so much, Dr. Lee, for attending today's event. My name is Erin. I'm one of COMSA's co-president with George. So thank you so much again for this event. I'm currently between my M3 and 4th year doing a research year. I'm doing my research at Beth Israel Deaconess Medical Center, but I go to school at Boston University. I actually had a question regarding your medical journey. You had really stressed the importance of finding a good mentor. And I think that's a topic that very commonly comes up amongst medical students. If you had any tips on how to find a good mentor and a criteria that one should have in terms of selecting a mentor.
Okay. That's a great question. And I will say that, you know, mentorship doesn't come in one shape and one size, right? So I have had and continue to have 2 or 3 mentors in different areas, right? 2 are men and 1 is a woman. And mentors can also be your sponsor. And we'll talk about what that means in a little bit. How do you find a good mentor? So all of you, when you select, is everyone here COMSA or are there some ComRAF people too?
I think it's primarily COMSA.
Okay. So when you go into a residency program and when you start interviewing for residency programs, part of that interview process is they're interviewing you, but the other part is that you're actually interviewing them. And you should definitely have a list of questions that you want to ask. And one of the questions to find out is, what does the mentorship scheme look like in that institution for house staff? Most programs will offer, will pair you up with a faculty advisor, right? When you match and when you're accepted into the program. But what a faculty advisor does is that's the gatekeeper who kind of keeps an eye on you, wants to make sure that you know what's what, you're doing what you're supposed to be doing. They're also the troubleshooter. If somebody else has a problem with you, they're referred to your faculty advisor to sort of talk about, you know, how this resident or intern is doing. If there's a negative evaluation or a positive evaluation, it's the faculty advisor who will reach out to you. The other role of the faculty advisor is to help you find a mentor. And one of the ways that we do that is when we meet with you, we find out what your interests are. And this is how my mentorship started. Find out what your interests are, and the faculty advisor will know the institution and have connections within the institution that they're working in. So they will see that, oh, Erin is interested in, oncology, particularly precision medicine, immunotherapy type of things, right? Or genetics or some type of specific area. And that will evolve over her 4 years. So or 3 years. So in the beginning, it might just be, oh, I think I might want to do oncology, or I don't know, but I want to do outpatient medicine. And it's the faculty advisor's role to sort of hear those things and start connecting you with people. You'll all have to do some type of an academic project before you graduate residency, whether that's a poster presentation or, a talk or a paper. And that also is something that your faculty advisor can help you make those connections. Once you do that and you outreach to those people, then it's up to you to sort of figure out whether or not you mesh. And you may not mesh with the person that you're first connected to, but never be afraid to find someone. Go into the directory. Mentors will not find me. Nobody comes and asks me if they want to be my mentor, right? I have to go find them. And I was fortunate enough that when I met with my section chief when I first joined Cornell, he was able to connect me with people that I just happened to work really well with. And they became my role models and my mentors for a lot of the areas that I wanted to explore, quality and patient safety, how to get involved with hospital operations. And then slowly some of them phased out and new ones phased in. So I would definitely look through the catalogs or the online website of your institutions now as medical students, and also when you become residents, especially as residents and fellows, see who's doing the type of work that you're interested in doing, who has a background that's similar to you. So I'm always really impressed when med students, even before I became an assistant dean, would reach out to me to talk about med peds programs. I never advertised myself as med peds, and Cornell doesn't not have a med peds program, but they were able to go through, somehow they were able to filter through and find who the med peds faculty were. And they reached out to me, even though I'm not practicing med peds now. So that's a great way to sort of talk to people. And I will say that there are also, you also want to see, ask the faculty who interview you how they were mentored, what during their time at the institution that you're currently at, because faculty who have been mentored have a passion to continue to mentor and to become mentors themselves. And that's something that I feel is contagious at Cornell. One of the reasons why I stayed at Cornell, and an opportunity that I continue to avail myself to for all levels of trainees, even not junior faculty. I work with them as their mentor. So those are some of the things that you want to look for. And CAMA, right? CAMA has, I saw that I really commend all of you for relaunching the survey, the mentorship survey. I filled it out. I hope other people fill it out too. We'll continue to advertise that among the CAMA national membership listserv as well. But that's another way that you can get mentors. They don't have to be part of your institution.
Hi, Dr. Lee. My name's Michael Hong, and I'm a second-year medical student at Florida State University. I just first want to say thank you for sharing some of the inspiration and the motivation, as you've discussed your own journey. I also am the membership chair of our National KEMSA board, and I was the one that's running that mentorship process. So thank you so much for signing up. We're really appreciative of that. And actually, since it was last posted, I think a few days ago, we've had over like 15 mentors.
Fantastic.
Yeah, and like 10 of them on the first day. So I've never seen that much engagement within like any sort of network in the medical community. So it's really amazing to see that. And I just kind of wanted to plug that to everyone else too. If you have questions, please let me know. But we're gonna post it on the KEMSA website eventually, hopefully. So I think it's a great opportunity, like you said.
That's fantastic. Let's figure out a way to actually post it on the CAMA website too. Let's brainstorm on that.
And just to clarify for all the students that are on the call, we're aiming to match CAMA and CAMSA as mentor-mentee pairs. This year, we've also expanded to matching CAMSA students with pre-medical students, just to help them throughout the whole med school application journey. So we have a lot of exciting programs that we're running that we're trying to get up. Does anyone else have any questions to ask Dr. Lee?
Yeah, I had one question. Dr. Lee, thank you again so much for being here and sharing your wonderful story with us. My name is Jacob Chu. I'm a fourth year here at Vanderbilt. I'm actually, just like Aaron, taking a research year between my third and fourth year, hoping to match into neurosurgery. As we prepare for residency applications and the whole process, you mentioned mentorship as being one of the really important qualities to look for in a new institution or place you'll be training at. In your journey, what are some other qualities that really you found important? I think geography can be one of them, for example, but some of the things that would we should identify in different programs, because it's a daunting process with so many options and places to be.
Yeah, yeah. And the reality is that in fields like neurosurgery, you actually may not have a choice, right? I mean, there's the really competitive specialties. You apply to 50, 60, sometimes over 100 programs. And so I certainly recognize that the choice is not always there. And also, I think most of you are still going to do Zoom matches, right? Especially Zoom interviews, especially this year. Maybe next year it'll be a little bit different. And that also, it's a plus in some ways, because you don't have to travel and you can apply to so many different so many programs nationally. But it also it's a minus because you don't get to see, right? You don't get to actually step foot and feel. Definitely a difference being there and then seeing it televised. But one of the things that I really urge you to consider if you have the luxury of doing so, is trying to find a place where you have a support network. Residency is tough. It's really tough. And there are some really, down moments, lonely moments. And it's challenging no matter how, close your class might be. If you just need one person who can really support you. And it doesn't have to be in-person support, but it's always nice. When I was looking to match in MedPeds, there were not a lot of MedPeds programs. So I didn't have a lot of options, and there were only there were 3 programs in New York City, only one of which I was interested in applying to, which was the Sinai program. And so the other program I was deciding between was University of Chicago. And I thought to myself, I've lived in New York City my entire life. This is my option to go somewhere different for 3 years, or I was doing MedPeds, so it's 4 years. And then maybe, live in a different city, and then I can always come back to New York. And so I actually ranked University of Chicago ahead of Mount Sinai was number 2. My very good friend who at Buffalo with me was in ophthalmology. And back then, ophthalmology was an early match. I don't know if it still is. She matched in New York City. And so that really resonated with me. I already had a lot of friends in New York. My family was in New York City. But now, my friend Suma was going to be in New York City too. And she was my closest friend for the past 4 years. And so we thought, wouldn't it be so wonderful if we can do residency together in the same city? And ultimately, that had that was sort of like the straw that really broke the back and made me at 11:55. We didn't have computers in our rooms back then, right? Not like you guys with these laptops. I had to go to the library to be able to change my match selection. At 11:55 p.m., I changed my match selection to Mount Sinai as number 1. And thank goodness I did, because I actually got a call from the University of Chicago program director, who was really upset that I wasn't going to come there, and wanted to find out what had happened and why I didn't match. So, and I never regretted it. Having someone to we had post-call days then, but just being able to get out of the apartment or get out of the dorm and, have a cup of coffee with a good friend who maybe not in your program, someone who's not, outside of your program, has a different perspective where you don't have to talk about work all the time. That is really, to me, that was very important. And I'm glad that I did that. So definitely keep your support network with you wherever you go, and make sure that you check in with them when you're having trouble, because it's going to be a huge help.
Thanks so much, Dr. Lee.
I think Christy raised her hand.
Yes, hi, Dr. Lee.
Hi.
This is Christy. Sorry it's so dark. I'm in my car. I'm in the car and my mom's driving. We just had dinner.
Okay.
But I'm Christy. I'm from Georgia. I'm a 4th year and I'm applying for internal medicine residency for this cycle. I had a question. This might be more specific, but I'm actually a mentor for a student who's applying to medical school. And he texted me today saying that he hasn't heard back from schools for on his interviews. Like, he hasn't gotten interview offers yet. And how can I comfort him? I don't want to say, oh, it's okay, you know, it's gonna work out. I just don't think those are like really comforting words for him. And I've been just thinking all day, like, how can I, you know, make him feel a little bit better? And like, since we're having this med talk, I don't know, maybe you can give me a little bit more advice so that I can go talk to him after this is over.
Yeah, so he's an undergrad applying to med school? Is that what it was?
Yes.
Oh, okay, all right.
Yes.
So,
Yes.
and is it late to hear back now?
I think he's a little bit nervous because all of his colleagues are hearing back from school,
Right,
and
right.
he haven't heard back from like a single program.
Mm-hmm.
And I don't know. I don't want to say like it's okay, it's gonna be fine. Like I want to say like something to him a little bit more than that,
Right.
and maybe you could give me a little bit of advice.
Wow, that's a tough one. I don't know. Anyone else on the call have any suggestions? I agree. You don't want to, well, you know, it is always helpful to try and stay positive for the person, right? So I would try and stay positive for them
Right.
and let them know that it's not, you know, things. So from what I don't know if this is still true, but a lot of the notifications were rolling. I don't know if they're still rolling
Right.
for med schools.
I think so. I think it's rolling admissions.
Yeah.
So-
So that's one positive thing. Anyone else have any
Right.
thoughts to help out Christy?
Yeah, so usually in this case, I'm kind of in a similar boat as well. I have a lot of people that I'm kind of mentoring in this process, and usually what happens is it always depends on each school and also like the type of application that the person applied to. Like for example, like when did that person apply, when did they submit secondaries, like all that can always affect when they get the interviews and whatnot. And sometimes schools just take a good amount of time, especially with like COVID and everything. I heard there's a lot of like staff shortages, at least for UNC, there were a lot of staff shortages this year. So they're just taking their time reading through applications. So compared to like previous years, it might be slow this year. And I know that especially when you're kind of hearing from so many different people that, oh, like my friends are getting it, but I'm not. And like that's where the comparisons and imposter syndrome happens. Usually what I think the things that I usually say is just like, don't worry too much about that, because at the end of the day, like you don't matriculate into medical school next week. You still have some time. And usually at that time, what you can do is you can try to like at least write down stuff that you're doing right now that you can potentially write in terms of letters of interest, for example, that you can potentially send starting in December or January if you're not hearing back from schools that you're interested in. And just kind of keeping yourself updated in terms of your resume so that whatever you send, like it can be something significant. So things like that, just keeping yourself updated, and always mental health, and those are super important to just keep in touch. Talking with people, therapy is always important. So those are the types of things that I usually mention. If it's something that's regarding my school, then I try to go to the admissions office myself and try to like gauge kind of like how the process is going so I can give direct answers for that certain schools. But for other schools, usually like I think November is still kind of somewhat early. I think for UNC, we have like 1/5 of the interviews done. So there's still a lot of interviews to happen. So that's usually how I kind of navigate that process.
Okay, thank you. Dr. Lee.
I think Michelle Lee has her hand raised.
Oh, yeah, hi. My name is Michelle. I'm also on the CompSci National Board, but I'm currently a third year at UT Southwestern in Texas. But yeah, I was also just like as another woman in medicine, I was wondering like you're holding so many positions and it seems like you do so much more than just your clinical practice. And so I was wondering how you balance that, and like I'm not sure if you have any children, but if you do, like how you balance that with like family life and things of that kind of.
Yeah. It's definitely challenging, right? I mean, one of the things that helps with that is I love what I do. I truly do love what I do. I love every hat that I wear. It's, you know, it's in alignment with my interests. And it allows me to be creative, and it also allows me to be very flexible, especially in this day of Zoom, so, but I think the challenging aspects, and these are the things that they don't teach you in med school. They don't teach you how to be a good administrator. They don't teach you how to balance a busy patient schedule and family life. They don't teach you that stuff. And so a lot of the programs that you'll be going into, you'll find residents who have similar situations or students who have similar situations that you're in. And so forming little groups on how to, deal with that and, sharing pearls with one another is really helpful and valuable. So, that's one thing to keep in mind when you go somewhere, is to find someone or find people who have some similar, facing some similar challenges to you, and kind of pick their brain and see how they manage. For me, I don't have children. I'm unmarried, and I live by myself. So in terms of my work-life balance, I do come home I'm able to rest when I want to rest. I don't have to work on anybody else's schedule. So that is helpful. Up until recently, I was the primary caregiver for my elderly grandmother, which was a little challenging, especially as she became sicker in her last days. But even that, because of a lot of flexibility in my work schedule, I was taking Zoom calls from her hospital room and so forth. And so that tended to work out okay. But certainly one of the also things that you want to think about when you do finally decide to settle in an institution is how much support they're able to give you, right? To sort of complete your roles. One person can't do it on their own. And one of the first questions that people who take on leadership roles tend to ask is, well, who's going to help me with my administrative tasks? Because, it took me 2 years, but I'm now able to have someone that I trust manage my calendar and manage it to the way that, we've worked together for, she and I have worked together now for about 4 years. So she knows my style, and she knows, how to manage my calendar, so I can just leave it to her. That's a huge burden off my plate, that I don't have to look through dates and try and find things that work. And, it helps to free me up so that I can, for things like tonight, right? I'm able to do that on my own because I don't have 15 other things I need to schedule that are in competing. So that's one of the nice things. But definitely administrative tasks are something that you do need to learn. And when you do go up for leadership positions, one of the things that I found extremely helpful is that when I became a vice chair, I asked my chairman to send me to a leadership course or a faculty development course. It was like a 3-day thing over at like one of the Harvard Business School courses. It was very expensive, but he agreed. I sent it to him. I told him why I thought it would be helpful for me to do it. I told him how much it was going to cost. And I told him how I was going to, pay it back with my service. And he thought that it was worthwhile. And so that's why I was able to do that. It was actually very helpful. It helps teach you skills like negotiation and administration, how to deal with conflict, which comes up all the time. One of the other big challenging things about leadership is I don't get to pick who I work with anymore. Now I have to work with, anyone who sort of comes my way, and we might not always have the same personality. So, knowing how to work through conflict is extremely important and valuable. That are also skills that you'll need to know when you start wearing different hats. So looking for opportunities to grow, but making sure that you're given the support and the training to do that is really critical.
Thank you so much for the advice. Yeah, it's really good to see successful women, Asian women. So yeah, thank you for setting a great example.
I just have a quick question. I guess one thing that's important to me is, as a medical student, like just being a Korean American medical student. And I'm really curious as to how your Korean identity, your cultural upbringing influences the way you deal with patients, you practice medicine, you function as a professional member. It's easy throughout clerkship year for me, I felt like, I want to be more like this American professor, this American resident, and I found it hard to kind of retain my cultural integrity. And so I'm wondering how you kind of emphasize your Korean upbringing amidst, everything we still go through and how overwhelming it gets in medicine.
That's a really interesting question because I think it's because I grew up in New York City. Well, when I grew up, I actually grew up in Roslyn, New York, which is in Long Island. And I only had, when I started there, I moved there when I was in the 4th grade. I only had 2 Asian families in my high school, in my junior high school. Oh, I'm sorry, in my elementary school at the time. And then by the time I graduated high school, we probably had like 50 Korean, specifically Korean families. It's like everybody moved from Flushing to my neighborhood to get their kids into my high school. So it was really interesting because I never, that part never really hindered me being Korean American. It never really occurred to me, I guess, as a difference. I'm aware of it more in terms of how I can use my Korean identity to help patients. And what I mean by that is when I started working at Sinai as a resident, obviously in Buffalo, there are not a lot of Korean people, right? There are some, but not a lot. So medical school was kind of different. But when I came to Sinai as a resident, one of the hospitals we rotate at is in Elmhurst Hospital, which is in Jackson Heights in New York. Jackson Heights they pride themselves by being the most ethnically diverse zip code. So I remember I was doing my emergency room rotation as an intern, and my emergency room attending was Korean. And we walked in one morning and there were 4 Korean halmonis in a row sitting there in stretchers, none of them spoke English, just waiting for us to come in. And I remember thinking, wow, this is really interesting. And it was actually very fun. And as soon as they see you, and as soon as they hear you say, oh, 안녕하세요, I don't speak Korean very well, but they just light up. And then they start opening up and talking to you and, yelling at you and, all these like sort of crazy things. So that part, that experience I'll never forget. And that really inspired me to learn how to speak Korean a little bit better, because I wanted to be able to offer that. And then my grandmother as well, right? And having been the primary caregiver for my grandmother, I wanted to be able to use that to help serve the Korean population in New York City. And I was able to do that when I was a medical student at Sinai. I did a little bit of it at Columbia, and even at Cornell, we get a lot of Korean. Primary language is Korean, and they come to Cornell to get their healthcare. So in that sense, I've been able to use it, but I haven't really experienced it as a detriment. I will say that I've also been a medical student for Korean American male residents. That's a different experience for them, I think, well, at least the residents that I was with. We also rotated at the VA as part of our Mount Sinai residency program. And my senior resident was Korean. I was an intern. And I remember the VA patients, some of them having served in the Korean War, were rather nasty to him, but very nice to me. And part of that is a gender thing, but they were, it was, so my resident would always send me in to sort of get the history because the patient was nicer and more amenable to talking to me than to my resident. So I think that the experience can be very different.
That's so inspiring. Thank you so much.
Elliot?
Hi, Dr. Lee. Thank you again so much for coming and talking to us. I am a 4th year at Mount Sinai, just applied to ophthalmology. So in the thick of it.
Yeah.
But my question for you is that I've sort of throughout this residency application process been thinking a lot about sort of where I'm going to end up, obviously, but then also like what kind of physician and specifically what kind of sort of Korean American physician I want to be. And with that, I think comes sort of getting involved in organizations like KAMA. So I was wondering if you could talk a little bit about sort of the ideal or optimal time to get involved in something like KAMA, sort of after training, whether that's a couple of years into your practice or if there are opportunities to get involved earlier on.
Yeah. So, one thing that I want to do next year is I want to have CAMSA and COMRAF be able to work directly with the National KAMA. I'm going to work with all of you with your executive committees for both organizations to include them in our executive committee meetings when we do the planning for events and for the national convention, the annual convention. Of course, I know fully that time commitment is very challenging, but that is going to be an open invitation for everyone to be able to attend those meetings, which we also record. So if you were to miss one, you can always listen in on the recording. But I think it's important to have your voices present during those discussions, because we want our events, all of them, to resonate with all of you. You are the future of KAMA, and without your involvement and your dedication and commitment and engagement, this organization doesn't stand a chance, right? So I really want to make sure that is something that you feel changes moving forward, so that you can be engaged earlier. And when to get involved, take advantage of all the free memberships right out there. AMA, I think American Medical Association, I think is free. There might be some other, if you're thinking about going into ophthalmology or urology or whatever it might be, like ACP, American College of Physicians for Internal Medicine, interested people. I think for students, it's free. For residents, it might be like $100 or something. But I will say that all national organizations, including KAMA, are very desperate and hungry to engage the younger audience, because we all recognize that the sooner you get involved and the sooner that we can get you interested in joining, the longer you're and the more likely you are to stay committed and stay on and grow as part of the leadership. So take advantage of it now, look around, join up for those. You don't have to attend anything, just being a part, getting your name on the mailing list. You can get newsletters. Sometimes you can get opportunities to do things for free, like free training programs. You could enter your abstracts and posters, sometimes for free and go and present those. So it's never too early to get involved. It's never too late, but it's never too early.
Awesome. Thank you.
Isaac?
Yeah, hi, Dr. Lee. Yeah, thank you so much for presenting today. It was really great. My question is related to kind of the previous two that Elliot and George asked, but I'm really interested in hearing how you set up that connection between Cornell and Yonsei, and like, I guess, what inspired you to do that, and what were the challenges and kind of in setting up that collaboration, because it seems like it's been really successful. And I'd love to hear.
Yeah, so I wish I could take credit for that, but we have this amazing dean who also happens to be Korean American. So it was really through him. So, the Korean government, as I mentioned, I'm a hospitalist. The Korean government about 2 or 3 years ago, it's a national health system, right there, it's universal healthcare. They stipulated, and they also run the GME programs across the country. So they stipulated that Korean hospitals now have to have a hospital medicine program. The reason they did that is because, similar to the States, they instituted an hour cap for resident work hour cap, right? So they followed us and they made it 80 work hours per week. Previous to that, previous to 2 or 3 years ago, it was unlimited. And in fact, when they did a study, they found that no surprise to anybody on this call, the Korean residents worked longer hours than any other country in the medical field. So, and that had to stop. So to make the Korean government thought that hospital medicine was the answer for the surplus, right? And that's exactly how it started here in America too. So, and then it evolved into an academic field, which is what it is for me today, not for everybody, but for the program I'm in. So they reached out to our dean to get help. And the way that connection happened was that the Dean Choi's mentee, when Dean Choi was in Boston, before he came to Cornell, he had a lab. And one of his mentees was from Yonsei. And Professor Kim from Yonsei was now in a position of leadership at Yonsei in the pulmonary critical care program, but was tasked to sort of figure out how to bring hospital medicine into Yonsei University. And so when that question came to Augustine Choi, he bumped that to my chief. And because I'm Korean and one of the senior leaders, he, Art Evans, sort of tapped me on the shoulder and asked me to help collaborate with 2 of the other Korean American physicians in our group. So we started that in 2018, and it is ongoing. I'm actually going in January. We used to, before COVID, we used to go 4 times a year. We would split it up to, 2 attendings per visit. But this year, moving forward, we'll probably only do it once or twice. But so that's how that started. The Australia connection I have is also is for quality. And that happened because a colleague of mine had a colleague of mine is trained in Australia. His co-worker from Australia was accompanying his wife, who was doing a sabbatical at Columbia University Medical Center. And so our car was here for a year, was interested in quality improvement, heard what I was doing and found our program on the webpage and contacted me. And so while he was here for a year, I worked with him on his project. I tutored him on his project. And he was so thankful for that and thought it was so valuable that he then introduced me to some conference leaders in a conference committee that he is a director in. And that's how that collaboration happened. It's really interesting the way you meet people. Yeah. But the whole point of that is advertise what you do, right? What that means is post it, send it out to people, publish it, present it as a poster at a national conference. You never know who you'll meet.
Absolutely. Thank you so much. It sounds like it really came about really organically and through these relationships. So.
And then Michael Hong.
Hi, yes, it's me again. Thank you so much for those sharing those responses. It's actually, I kept on coming up with questions and they were just asked and you gave really great responses. So I guess in response to that, maybe are there any sorts of ways you can see KEMSA kind of providing or cultivating this supportive environment so we're not, we're focusing the KEMSA organization more on community rather than, thinking only about your profession in medical school and making it just like a professional organization, but more of also like a social community, if that makes sense.
Mm-hmm. Yeah, that's actually really important. I actually think that the social part for KAMSA is really critical because, in my assistant dean role, I see the struggles that the students go through, and having a peer environment where you can just come and talk to people and hear some other students your same age, maybe in a different part of the country, but going through the same problems or the same issues or the same difficulties and trying to figure out how to get through it together, I think is incredibly valuable. So, being students, I truly commend you on how organized you are. I'm so impressed. I heard about you're renting an Airbnb for the convention, all those, what you guys are organizing, the abstract competition, it really is astounding to me. We can't even get that together, right? So it's astounding to me that students who are as busy as you are able to do that. And I hope you're definitely going to put this on your resume, because this is a national, organization that you're leading. And so definitely highlight that in your interviews when you meet with your, the people who are going to interview you for residency. It's a huge part of scholarship, and getting other COMSA members or other medical students involved, I think is critical. And, anything that you think of, and one of the things that why I keep bringing up having you engage, the leadership engaged, is because COMA needs to hear it too. And, COMA unfortunately is very poor. We don't have we don't have a lot of money, but we do want to do what we can, if we can, to help raise funds for the students to do activities, especially, once COVID kind of subsides a little bit and we have a little bit more luxury to meet in person. But things like that, anything that you come up with, let us know.
Thank you so much. I appreciate it.
I think that's about an hour, but Dr. Lee, we just want to say thank you for, donating your time so graciously. It's not every day we can see someone who looks like us, and there are so many schools where there isn't any like Korean physician at all. And so the fact that you did this for us, it's beyond generous, and we've certainly learned so much from, the wisdom you've accumulated, and I hope we can all turn it into practice. And with that, if there's any final questions, Erin, any announcements, please, I just want to say thank you.
Yeah,
It was-
thank you. Oh, sorry, Dr. Lee. keep
No,
going.
no, it was absolutely my pleasure. I love talking to students and residents and fellows. It really is such a joy for me. I'm actually, we're starting our interview season next week, so I'll be interviewing some med students who want to join us at Cornell for residency. So it really is such a joy to do this, and absolutely, never a burden for me. And I know that there are a lot of other people who would love to get involved in meeting with all of you and spending some time with you. Again, George, you have my email, and Isaac, you have my email. Feel free to share it. I'd love to hear from you. And I do want to encourage all of the students to get involved in that mentorship network with COMA. And also, if you find that your mentor is not, the right person for you, there should be a way to reconnect and go back into the lottery, right? And get somebody else, because having someone who connects with you is really important. So, please, engage. And I hope I see some of you in California in December.
Just a quick some announcements just to the students. So we have a convention coming up, the COMA convention. It'll be December 2nd through 4th. I think COMSA is going to be organizing housing and transportation for students, just so that it's very expensive traveling, especially if you're traveling from one coast to another, so that it relieves some of the financial burden. So we would love to see everyone there. We're very excited. I think COMSA is also planning a little social of our own, and I know there's a gala so that we can have even more FaceTime with members of COMA as well. And then for the attendees of these events, we do have a little raffle going on. So if you're interested in entering that raffle, I could put the details in the chat. So feel free to fill out that form. But thank you again so much, Dr. Lee. We really appreciate your time.
My pleasure. Have a great night, everyone.
Thank you.
Bye-bye.
Thank you.